Thermography interpreter. She is the founder and clinic director of Divine Living and the Thermography Medical Clinic. And by my introduction, I'm sure you would have guessed we're going to talk all about thermography. And I have actually been diving deep on a lot of the literature, the studies, and even the tenure of thermography. It's been around for a long time, and I've had so many people ask me about it. So I really wanted to do a show about this. So here I've got an expert. And with that, welcome, Sharon. Thank you so much for coming today.
Well, thank you. This is going to be fun.
I think it's going to be fun too, because I love looking at tests and I love looking at where I can improve my health. And the one thing I will say, Sharon, I'm like, wow, here's a person. I'm a holistic nutritionist. I do all the things, and yet there's always room for improvement,
hmm
right?
Yeah, and I think knowing which areas need improvement, I think that's key for people, right? So,
Yes.
yeah, we can be involved in, the health and wellness world, know what we need to do or think we know what we need to do. But yeah, having information or a test that can actually help you see maybe where you're missing something, right? Or you
Yes.
haven't thought about something. I think that, helps us to, again, individualize our treatment protocol and make it unique to what our body actually needs.
I agree because see, what happens is you might think you're doing all the things, which
Mm-hmm.
is me, but then there's other factors involved that
Mm-hmm.
might not be enough for me. Like
Mm-hmm.
come into play, like let's say we bring genetics into play.
Yeah.
We all know
Mm-hmm.
genetics is it's not the be all end all. I'm a big believer in epigenetics and turning that switch on, but maybe something's not good for me, even
Mm-hmm.
though it might be good for you. And I think it's
Right.
doing the right thing for me. But wait a minute, my thermography is highlighting. I like the term highlight
Mm-hmm.
because it's like it's highlighting. Okay, wait a second, Sandy, there might be problem areas. So I'd love to start by getting into your story. How did you get into thermography?
Yeah. Well, so it wasn't how I originally like it wasn't how I started my practice. So I actually started my clinic Divine Living in 2005. And like every practitioner, there's a first client, there's a first patient, whatever they are, right? And you have to figure out how to navigate that appointment. And of course, I had the typical, questionnaire, come on in, answer all the questions, and then you try to figure out, well, like, what the heck do I do? Right. And I thought, oh my gosh, like, this is more stressful than I thought because like you, I think I'm a visual person, right? And I like to have tests or some kind of evidence that, you know, validates maybe what I'm doing in terms of a treatment protocol for my client. And also I think something that gives my client or my patient like information about what's going on with their health. So I actually originally started with different testing tools like biofeedback. So that's what I did for a while, and that proved to be a really useful tool for me. I do get bored, so I like challenges and fresh new things. So years later, in about 2010, I started looking into other tests, like other things that I could bring into my practice, and I came across thermography. And so I, purchased a camera, got some software, and I introduced it into my clinic in about 2011. And first, and I don't want to talk a lot about breast thermography, but that's kind of how I was introduced to thermography. And very quickly, I realized here I am offering breast thermography. I'm taking one part of the body and looking at, thermal patterns here. Um, there's more skin than just the breast. And so certainly there has to be a whole body application. And not many people at that time were really talking about whole body thermography. They talked about it a little bit and it could be done, but nobody really wanted to do it. And nobody really wanted to spend the time learning, I think, how to analyze all of that information, right? So, yeah, I introduced it in 2011, and very quickly I moved from the concept of just focusing on breast and women's health to focusing on whole body health. Eventually, thermography consumed my life. We have multiple clinics like throughout Ontario. We've expanded like to BC as well. I started getting involved in analysis and interpretations and providing interpretation services to other thermographers in various parts of the world, the US, Europe. I have a lot of clients there. So eventually, thermography consumed my practice and it consumed my life. And so that's essentially how I've sort of evolved as a practitioner. I did give up my divine living practice in 2022, I guess, so a couple of years ago, and just so that I could focus solely on thermography. And I guess I would say that like I've evolved with thermography. Thermography has evolved with me over the years. So we've kind of grown together, thermography and me. We've really, I think, pioneered and moved forward in terms of this whole concept of whole body health assessments with thermography. And I essentially started using, of course, thermography in my practice because I wanted to be able to give people a visual picture, right, of what was wrong, where their body was asking for help. So I wanted that for me as a practitioner so that I could be very specific with addressing the underlying cause of what was going on. But I also wanted my patients to see what was going on with them. So it would help them to understand what's going on, what are we doing, and then, of course, using thermography to monitor the progress over time. And, are we doing something that is actually working and that is making a difference? So it really helped me, I think, to focus as a healthcare practitioner on underlying cause, which helped me expedite, the treatment protocols and the process through which my patients went through in order to get better.
Okay, so I think the most important thing we should do right at the beginning is define
Mm-hmm.
quickly, because I think most people who are listening to this will have an idea. What is thermography?
Mm-hmm. Well, so, we can give a technical explanation or we can give a very simple one. And I prefer the simple one. And so thermography is essentially a test that allows you to see how your body is functioning. So we know that inflammation, infection, poor circulation, imbalances related to the musculoskeletal system, dental issues, changes in blood flow, blood circulation can all be seen with thermography. So thermography essentially is a test that allows people to see how their body is functioning. And it's also a test that, can be repeated over and over and over again without causing harm to the patient to help them to see if what they're doing is actually working. Are they moving towards health or are they moving away from health?
Right. It's using thermal imaging camera.
Mm-hmm.
From what I read, it said it goes to about a quarter of an inch
Yep.
depth
Yep.
in skin, and it monitors thermal or heat patterns in the skin, right?
Absolutely. Yep. So it's an infrared camera. It's capturing or it's measuring skin temperature. And it doesn't see inside the body. Some people think it sees into the body, sees the organs. It doesn't. So it's measuring skin temperature. And depending on what the body is doing from a physiological perspective, blood flow is either moving, towards the skin or it's moving into the body. So vasoconstriction, vasodilation, those are the fancy terms. So depending on what's going on, there's thermal maps that are created when you're looking at a thermal image. And so those thermal maps are what actually give us insight into what's happening in terms of a person's health. So yeah, there's the camera, there's the patient, the camera collects the data. We have software that we use to, present the data that's collected. And of course, we have the software that helps to analyze the data as well.
I was going to say, you mentioned
Mm-hmm.
whole body thermography at the beginning.
Mm-hmm.
I could not agree with you more, Sharon, on
Mm-hmm.
looking at the whole body. I mean, you and I met a
Absolutely.
while ago and we were kind of talking about this. I'm like, okay, ladies, if you're considering breast thermography, which I think almost every woman around midlife has heard of,
Mm-hmm.
or, some younger who are
Mm-hmm.
really health enthusiasts, but you got to look at what is affecting the health of the breasts. And
Absolutely.
I've said this all along, Sharon,
Mm-hmm.
that our body doesn't work in silos. Like you can't
That's
just
right. That's
look at the
right.
breasts,
Yeah.
right?
Yeah.
Like
They're
there's
not separate from us,
yeah,
right?
they're not these entities that are
That's
separate
right.
from the rest of our body.
Right.
And so this is why I was like, whole body just made sense to me. But
Mm-hmm.
way long ago, when I was in my 40s, I was like, I think I did thermography twice, but it was only breast thermography. I don't even recall whole body being an
Mm-hmm.
option, or maybe it was astronomically more expensive or something that I wasn't able to do it.
Mm-hmm.
Whereas
Both of
you
those things.
encourage that, right?
Oh,
You encourage
absolutely.
people to do the whole body, which I think is great because
Yeah,
the price differential is not massive.
that's right. That's right. And like it almost drives me nuts when people don't do like the whole body because I'm like, there's something missing. There's so much information missing, right? So we'll see like inflammation in the breast, right? And it's like, why? That's the question I have, right? And I can't answer that without
Yeah.
looking at the rest, right? Because there can be a lot of different sources of that inflammation. So it's one thing to know that you have inflammation, it's a whole other thing to know why, right?
Like,
So
where's it coming from?
where the heck is this
Yeah.
coming from? Is it dental? Is it your gut? Is it your liver? I don't know. Is it your stress level? And like thermography can show you those things, right? Where's the inflammation? That's one thing, but where is it coming from? And that is like, that's the piece of the puzzle that is, so valuable.
So, okay, speaking of
Mm-hmm.
where is it coming from? The one
Yeah.
thing I'm going to stop right here and just
Okay.
say to anybody, this is a disclaimer, nobody is talking about giving any medical advice here.
Mm-hmm. Mm-hmm.
Thermography is simply a tool and a map to kind of what's going on with your body. It's
Yeah.
technically not a diagnostic tool. It doesn't give you a diagnosis like you have breast cancer.
Right.
No, it doesn't do any of that, but it will show thermal patterns where there may be potential issues. Does that
Mm-hmm.
make sense?
And also, I'll just expand on that a little bit. So it will show you where there's potential issues, but if you already have issues, it will also show you why you have those issues. So it's a tool that can be used for somebody who's thinking about prevention, proactive health, right? But it's also for somebody who has something going on and they're not finding the answers. So in either, stage of your health, it's a useful tool to show you, hey, this is where something is brewing. You can, reevaluate and change that. Or, you have all these symptoms. Well, this is the reason why. So let's address those key things.
Okay, so how is it different? I guess we kind of answered that, how it's different from an X-ray versus an MRI versus a
Mm-hmm.
mammogram.
Yeah.
We've kind of
And
addressed that.
yeah, so they're different tests completely. And so thermography, as I call it, is a functional test, or it's more sensitive. And I'll get back to that. Other tests like structural tests, CT scans, MRIs, ultrasound, anything that is invasive is a structural test. And those tests are very focused on a very specific thing, right? They're looking at, trying to diagnose you with something, or if you have an injury, they're looking at that specific place where the injury is or where the problem is expected to be. Thermography is more sensitive, and this is talking about whole body thermography, in that we have the ability to look at the whole body and how is the whole body functioning in the context of this person's health condition. So even if people have an injury, thermography is useful because we know that the injury doesn't only affect where the injury occurs. There's a response that the body goes through, right? Sympathetic response. If it's an injury related to the musculoskeletal system, there's going to be compensation, those type compensatory mechanical behavior that happens. So, thermography, again, it's a test that's more sensitive, meaning it can show you, again, where the problems are, where they're coming from. It's non-invasive, so you can repeat the test over and over and over again without causing any kind of harm to the body. Other tests, like you mentioned, the X-rays, MRIs, CT scans, biopsies, all of those have some degree of invasiveness, and they can actually cause harm to the body. Even though they may give you information, they still run the risk of causing harm. And so the tests can't really be compared. One's better than the other. I don't like that kind of way of comparing thermography. Thermography, I think, has its own unique contribution, and it's not meant to compete with any other test that exists out there.
Mm-hmm. I was pretty fascinated by my own results, which you guys listen, stick around, because I always think, and hopefully you're watching this, I won't put up my breast photos because, I mean, listen, people always wonder, like, are you looking at nudie pictures? You're
Yeah,
not,
right.
right? People wonder, like, what is that person seeing behind?
Oh my God, I know.
So it's not, but you can still see the outline of the person's body. But you
Absolutely.
see reds, blues, greens, yellows. So I think it's really important that I show some of my photos so that people can kind of see what there is seen. So it's, I'll tell you just from my personal experience, very private. You walk into a room, and the person who's taking the photographs, the thermographer, right? Is that what they're called? The
Yeah,
thermographer?
our thermography technician. Yeah.
Okay. So they're behind the curtain taking the photos from the computer, not from the actual camera. The camera is out, but they are behind there. And so it's not like they're out there looking at your naked body taking the pictures, which I think it was like that when I was in like around 40. Like that was like
Like, oh my
a
God.
long time ago, by the way.
Yes.
So I'm 54 now, just in case people are wondering, okay, well, how old are you? So how do we know how long that was? That was a long time ago.
Yeah, yeah.
So they're looking at the computer, which is the thermal patterns. So yes, they can see the outline of your body. They can see all of that, but they're not looking at like a naked photo of you. So I think it's
Right.
important that we clarify that a good thermography, whoever provider that you go to should have some privacy stuff in place, right?
I agree. I think, we moved to privacy screening years ago. Um, Part of the reason I think we're able to do that is we have like a stand that allows us to do that, right? Where the camera's on and it's pretty automated and whatever. But the privacy screening, I think it just really gives the person comfort, right?
Yes.
Yeah,
Yes.
and just makes that whole imaging experience better, more professional, and yeah.
Yes, exactly. So I think that's really important to note. The other thing I wanted to ask you is,
Mm-hmm.
could so when I was there, I was asking the technician about what if a woman has a hot flash? And she was
Mm-hmm.
explaining that they will stop, let the
Hot flash, come and
hot
go.
flash pass so that the vasodilation is not seen.
Mm-hmm.
So is it possible that if somebody's really nervous about going to get a thermography, that their nervous system patterns, cortisol would still show like more of an active, overactive nervous system?
It could. But I think when one thing is that when the technician like sets you up in the room and the camera's on, like, and she's sitting there looking at her computer, she can see what's going on. She can see whether you've acclimated, she can actually see patterns changing. And she knows, or they have like an understanding of, oh my God, this patient is sweating, or they're so nervous, or whatever, right? So there's an
Okay.
awareness of that, like as a thermography technician, of what's going on. But you know what? We have people who come in and they're nervous, and it doesn't. I wouldn't say it really alters their study to the degree that a hot flash does, right?
Yeah.
And so, yeah, the technicians know, they're like, oh, there's a hot flash coming on, and they'll even see it before. Oftentimes, the person sitting in the chair in front of the camera feels it. And sometimes, like, oh, I see a hot flash coming on, right? And the person's like, what? And it's like, oh my gosh, how did you know? And so you can
Yeah.
already see the skin starting to change, right? So,
Okay.
yeah, then they just wait for that hot flash to go, and things go back to sort of their normal state.
Let's get into the
Fascinating.
studies, Sharon. What do the
Mm-hmm.
studies say? Because I read a huge one from the National Institutes of Health. It was more of a review on
Okay.
thermography. And
Mm-hmm.
there's some interesting data because they
Mm-hmm.
were actually reviewing in this about thermography as a tool for breast cancer. I know,
Mm-hmm.
we can't get into it as a diagnosis, but that's just a review. We're not talking about it. So, what have
Mm-hmm.
you researched in terms of thermography as a viable resource to monitor
Mm-hmm.
health and wellness?
Mm-hmm. So I think that when it comes to research, sometimes what happens is that um, they're trying to stick thermography in a very small box, right? Like we want thermography to see diabetic foot. We want thermography to see breast cancer. We
Yes.
want thermography to see these things. I mean, you can't make thermography see anything because what thermography sees essentially is what's going on with the patient. So we may have somebody that comes in that has a diagnosed condition. They may have heart disease, they may have cancer, they may have whatever, but we don't necessarily see a specific pattern that confirms or denies or says, yes, this person has breast cancer, here it is, or
Yeah.
yes, this person has heart disease, here it is. That doesn't mean that we never see those patterns. Again, it depends on what's going on with each person and what is being prioritized. So, in terms of research, I think that there is that risk that sometimes we're just trying to shove thermography into this little teeny tiny box and make it see something that it doesn't necessarily see or that it's not going to see all the time. We're actually involved in research. We have involvement in clinical and research trials, some of which I can't speak of, obviously, because I'm under an NDA, but we
Okay.
do research, and it's interesting to see, what happens in, in those environments. Um, so, yeah, there is research that speaks about the validity of thermography and the accuracy of thermography. But again, I think, with everything, there's always research that needs to be done. I would love to see more research in the field or in the use of thermography, of course, as like whole body health assessments, right? And again, like I say, a lot of the research is very specific to keeping thermography in a very confined box. So, yeah. And then, of course, there's research and applications for, athletes and injury, and there's all kinds of, research out there.
You know what I found super fascinating, and I know people are going to want to know my results, which I'm very transparent. I'm like, other than showing
Here
you
it is.
other than showing you my breasts and my whole naked body, I am pretty out there. I'm
Mm-hmm.
happy and fine to talk about results because I think it's important that people know what I'm doing as a practitioner to action what I've seen because
Mm-hmm.
I think this is the biggest question is, okay, I got this information.
Now what?
Now what? So there's many ways we can take this conversation, but what I
Mm-hmm.
will say for me personally I think it's very important. It's individualized. So, for
Mhm.
example, I'll talk about my hands. And Sharon, I was like, holy crap, what's going on? So, what's really fascinating is that my right hand was much worse than my left. And I will pull up some of the pictures. Maybe I will share my screen right now just so that you
Okay,
can.
let's do this.
So let's do this. So
This will be
if
interesting.
yes, if you're listening to the podcast, you're going to want to listen and watch on YouTube or on Rumble. Just look for Sandy K Nutrition. You'll be able to find it because I think it's really important that, we kind of show what we're talking about. So, the first thing I'm going to do is show this one picture. So, do you see my screen? Which one do you see?
Yep. Yep.
You,
I see your screen and I see your right arm.
yeah. So you see the right arm only.
Hmm.
I can't tell what what's showing. So you can see that this hand is very inflamed. And one of the comments from the assessment was my nail beds were very red and inflamed, my hands, but especially my right hand. I've had chronic pain in my hand since 2022. And this, I have actually had an MRI. I know what's going on. And it clearly very much showed that there's something going on with my right hand. So I'm going to actually show another photo. Just give me a second here because this is okay. So this is another interesting photograph or what do you call it? Thermograph?
Image, image.
Just
Let's go with image.
so I'm
Make
I'm
it
actually
much easier.
I'm really complicating things, aren't I?
Yeah. So, well, these hot hands actually indicate like cardiovascular, blood sugar related
Okay.
issues.
Okay, yes. So, okay. Okay. This is so fascinating because cardiovascular, I was like, that to me is very interesting. I'll tell you
Okay.
what I'm doing with that. But blood sugar, I also had an HbA1c of 6.1.
Mm,
This was also in 2022
okay.
when I started to have problems with my wrist. So it all kind of coincides.
Hmm.
So what are the red nail beds?
Well, so it's just, it's kind of the way we describe the image. The hands, the nail beds, they're unusually hyperthermic. So we don't expect the hands to have that kind of a patterning. We expect, the fingertips to be cool, so to be like a blue color.
Okay.
They should be symmetrical. So this is a completely opposite expectation of what we have. And yeah, so this is something that certainly is an indication of, again, this underlying cardiovascular stress, blood sugar imbalance. Underlying to that, typically there are imbalances in the body related to gut health, adrenal stress, those types of things. But this gives a person kind of an indication of like, where are you headed, right? Like with your health, like you're sort of on this pathway towards cardiovascular related conditions and blood sugar imbalance. Now, what is it that you can do with this information and change underlying, physiology to, help your body, head in a different direction, right?
Okay. So here's what else is really interesting. So okay, then the picture that I'm showing right now, it shows the inside of my hands. And there's
Yep.
actually white in there. What is the white?
So it's just, kind of on if you look at the little temperature gradient on the image, right?
Yeah.
It looks like a thermometer. You've got the blue to the white. It gives people this image of kind of where their level of, hot or cold is, right? So white is kind of the hottest part of that temperature gradient. So it's just hot. Your hands
Like
are hot.
it's like beyond hot if you look at the scale. It's like I'm
Yeah.
beyond hot. Okay, so I am going to get into what I'm doing, but
Okay,
I wanted
let's
to
talk
show
about
those.
that.
Okay, so it's listen, you're a holistic health practitioner, and we all
Hmm.
know that you can't just go and do one thing.
Right.
It's never about one thing. Number one, here's what's interesting. I'm going to say it's not blood sugar because I've gotten that in control.
Hmm.
So my HbA1c was 6.1. I'm down to a 5 now. Um, and I've done a lot of work. I had to do a lot of work to lower that.
Hmm.
So that leaves me to just maybe the heart. And then there's inflammation. You're going to laugh at me, Sharon. You know what I did right after I got
Hmm.
this? I actually went and removed my gel nails after 6 years of never even having a break. I kid
Wow.
you not. So, because I'm like, okay, this is really weird. The fingertips, even though I'll choose whatever it is, the 5 free or the 8 free gel, you're still
Yeah,
using UV LED. You're still, I
there's
just,
still exposure.
I still think it's toxic because it's three
Hmm.
layers. You've got gel, you've got polish, that's a gel polish, and then you've got the UV. Those are three different factors that go on there. And there's still a lot of research out there that they say that it's toxic no matter what you use. So
Hmm.
I went and did that. And I'm
Okay.
like, so because I immediately energetically, I felt like something was not good for me in doing this.
Hmm.
Nobody's perfect, right? And then there's the
Oh,
inside of my hands. I was like, okay, well, I had an EMF mitigation device on my phone, but I changed it to one that I had used prior to that just to help because I immediately thought maybe it's all the radiation. Part of my job is being on my phone all the time, Sharon.
yeah, that's not good. It's not. I mean, it is exposure to EMFs, right? And yeah, we know that that's harmful
Yeah.
over time.
Yeah. So
Hmm.
these are just two things that immediately came to mind. And I felt like, I just really need to do this. But then, this, I had a full protocol. Have you ever worked with UNDA?
Yes, I have.
Yeah.
Absolutely. In the past, I did.
Yeah.
Hmm.
It's like one of these age-old homeopathic, um, it's not one remedy, it's many remedies.
Many together. Yep. And
Many.
combinations.
Yeah. So I started a drainage protocol because I will show part because you did mention lymph.
Absolutely.
So
Something that so many people don't think about.
no.
And a lot of people aren't even aware of what the lymphatic system actually does. And so sometimes they'll read about it in a thermography study, and it makes them actually start investigating like, what is this lymph system? And what does this actually mean? Right. And, how did I get like this? And what is it that I can do to improve how my lymph system is functioning?
So this, I know you had said this, I put up another photo. For those of you who are watching, you can see my neck. That is also related more to the I can never say the word
So this is
muscular
actually
skeletal.
So this is actually carotid artery inflammation.
Oh, crap. So that's where the
So
heart came from, Sharon.
absolutely. So you have this combination as well of findings. You've got the carotid artery inflammation, you've got the hot hands. Again, it's an indication of your level of inflammation. So the cardiovascular system can be affected by stress, right? Just life stress in general, of course, dietary lifestyle things, the way a person's nervous system is functioning. If you're in fight or flight, if your sympathetic nervous system is on high alert, that's also going to affect your cardiovascular system. So we help people to, understand the thermography report and unwind everything. Like we have, cardiovascular stress, then we have digestive imbalance, and how is that all connected? And what is it that I can do in terms of, yeah, just changing the environment.
Yeah, I think that, you know, I just don't
This
want
is
people.
musculoskeletal.
So I don't want people to look at this and be scared shitless. Oh, there's the blue.
No, that's cool.
Um, I know it's the Zoom thing now. I just don't want people to look at these pictures and go, "Oh my God, she's a holistic nutritionist and look at all the crap that's going on with her."
Mm-hmm.
But what I'm going to say, it's not a diagnosis. Let's
Exactly.
reiterate that. So people don't
Mm-hmm.
look at these pictures and go, "Sandy's dying." Oh
Yeah, right.
my
No.
God. I'm not dying, everyone. I'm
Yeah,
good. So the first picture was the carotid artery strain
yeah.
of the neck.
Mm-hmm.
This picture is showing the musculoskeletal. I
You
still
said
can't
it.
say the word.
It's pretty good. Yeah, so this is like, neck strain, muscular inflammation. And I mean, how many people do we see this in? A lot. We are a population of people that lives on technology, right? We are on our phones, we are on our iPads, we are on our computer. And, I mean, that affects your musculoskeletal system, prolonged sitting, prolonged like or repetitive movements.
Yeah.
So this again, it just gives you an idea of how is your body responding to your day-to-day activities. Do you need to get up and move more? Do you need to stretch more? Do you need to actually go to the gym? It kind of answers those questions, right? So yeah, this is like pretty commonly seen in somebody who is at a computer for a fairly long period of time every day.
Yeah. So, I mean, I'll share this one with you. This is my belly. My boobs are
Mm-hmm.
hidden, so no one's looking at my boobs.
We can
Um,
see the bottom stuff.
you can see the bottom a little bit, but who cares?
Mhm.
So the right side,
Yeah,
we know that the gallbladder and the liver are there. We know that, kidneys are on both sides, right?
yeah.
So one of the things that you had mentioned in my report was liver as well as kidneys.
Hmm. So
So
this lovely little
what is
like
this? Yeah.
yeah, so that we call that like a vertical pattern, right? Kind of looks like a lightning bolt. That is kidney adrenal stress. Very classic pattern. And that's yeah, it just means that your kidneys are struggling, your adrenals are a little bit overactive. Maybe you need to drink more water.
That's
You
not the
know,
case. Yeah, that's not
so
that ain't
probably
the
kidneys
case
and
here.
adrenals work together, right? When one becomes stressed, so does the other.
Here's a question for you, Sharon.
Mhm. Yeah.
So, if you're a menopausal woman,
Hmm.
here's what I always find interesting because I speak to so many menopausal women. Oh God, what's wrong with me today? Many menopausal women
Yes.
don't realize that when their ovaries are shutting down and are no longer producing estrogen and progesterone, their adrenal glands must do that. They take over, not to say
Absolutely.
that they don't do it, they produce a little bit, but
Hmm.
after the ovaries are done, they produce your sex hormones for you.
Yes.
So I'm going to say for a menopausal woman, having a little bit of strain on the adrenal glands makes sense because the adrenals are like, crap, I got to do all this work now on my
Hmm.
own. I don't have
Yep.
any more help. What are your thoughts on that?
Well, I think this is a really interesting discussion because what happens too is a lot of women going through menopause end up on hormone replacement, whether it's bioidentical or
That's me.
prescription,
Yep,
right? And so, again, like that's about treating a symptom,
it
right? But
is.
we can help to improve the body and maybe, help women to not have to rely on that stuff as much by knowing if your adrenals are tired, if you support them, if you improve your gut health during menopause, you're going to possibly eliminate the need for, those types of hormone replacements. And, people often think, oh, well, I'm taking bioidentical hormones, like they're safe. Well, they all have an effect. And we can see that in a thermography study too. Sometimes we have women come and have a thermography study before they start taking hormone replacement therapy. And you can see how that is affecting their body and how it may cause more harm than good. It may cause more inflammation than actually resolve the issue. Because again, health is about, I think, addressing the underlying cause and not just treating the symptom. So, yeah, menopausal women, take a look at your health and what your body is doing, and where it's trying to show you that it needs support, and then support those areas. And you may be surprised to find that you don't need to go on that journey of hormone replacement therapy.
Yeah, I do, because I'm trying to think if I started, because believe it or not, I actually got a period on March 1st. I'm like, okay, here I am again. I know. I know, right? And so I actually did stop my hormones right around this thermography. So I wasn't taking it then for, I think, a couple weeks at least. Definitely no estrogen. So it's all very, very interesting. I am going to show
Mm-hmm.
the other side of my belly. So this is the other side. Do you see it? And
Yep.
it's that same line along the kidneys, right?
Mm-hmm. Yep.
So I think it's really important to also show the other piece to this puzzle, which would be my face. 'Cause-
Oh yeah,
Oh,
you did.
yeah.
That's
So
fine.
I was looking, you see
Oh
it, right?
yes, yes, I
Okay,
remember.
this is a really interesting um,
Mhm.
therm thermographic photo because it showed clearly I have an old root canal,
Mhm.
very old. It was from 2005 or 2006. And I often
Mhm.
wondered, wonder if it's giving me any issues. And I actually just had a dental implant, which I felt went very, very well, aside from I had a little bit of irritation when I first had the what is it called? When they first
The post thing.
no, the crown. When they put
Oh,
the
the crown.
crown
Okay.
in, there was
Mhm.
a bit of irritation around the gum line. And I muscle tested. So this is a little bit of an offshoot, but um, the way that I lost my tooth was through a dental procedure, everyone.
Mhm.
Yes. And what happened was I ended up developing a condition called condensing osteitis, which
Oh.
I had two choices. I had either to do another root canal or take the tooth out. And I chose to take the tooth out, get an implant. I did titanium, not ceramic. I know everybody's all about the ceramic, but you have to also, there are definitely some caveats to getting ceramic. You'd have to speak with your dentist on if you're even a candidate. You have to have ample bone. There could be a lot of issues. I muscle tested very strong for titanium, meaning, and it was with Strowman. It's a very, very well-known company, high quality. So I have to add that in there. And then I also recorded with an expert. He's a biological dentist. You can listen to that recording. I'll put it in the show notes. But often questioned Sharon about this on the
Mhm.
other side. And so my thermography, by the way, didn't show any inflammation in the new implant area, which is good news,
Mhm.
right? On the
Yeah.
left side. But this side, it showed red where I have that old implant.
Mhm.
So do you see
So
that a
name the
lot?
time.
Not implant. I'm sorry, not
The
implant.
root
Sorry,
canal. The root
root
canal.
canal. Let me correct
Yeah.
that. Yeah.
And so again, this is a really good way to answer those questions, because a lot of people ask that, I have root canals. Are they causing me problems? Right? Some people, the root canal has been done correctly. There is not any kind of lingering infection.
Oh,
And in some people, there is this lingering problem. And so this is a really good way, again, to like answer those questions. Is this a problem? Is this not a problem? Is this something I need to take care of? Is this what's causing my health issues? For some people, root canals that they had no idea have infection in them. And trust me, like we see some very wild and interesting patterns that are screaming like infection. These people have had chronic health issues for years. They've tried everything, spent thousands of dollars. They come for thermography and it's like, hey, did you ever think that root canal is causing like all of these problems? They're like, no, nobody ever talked to me about that as being an issue.
oh.
And they go and find a dentist, take care of this root canal, have the tooth extracted, whatever it is that they do. And it makes an incredible improvement in their health because they've addressed, right, the underlying cause, the thorn, the thistle, the sliver, like whatever you want to call it, they dealt with it. So it's a great way, again, to answer those questions like what's going on with my health and why do I have these symptoms and where are they coming from? Just because you have symptoms, in one part of your body doesn't mean that that's actually like where the problem's coming from. So you've got to look further.
So to add to what you're saying, I will say Dr. Kelly Blodgett, that's who I interviewed. He's in the US. Blodgett Dental Care, I think is his Instagram handle. He talks about exactly what you're saying, that
Mm-hmm.
people will have multiple mercury fillings, multiple root canals. They clean out their mouth, clean it
Yes.
up,
Mm-hmm.
and all of a sudden they no longer have issues with their lymphatic system,
Mm-hmm.
right? So
Yeah.
maybe part and this is where the investigative work has to come in, and you've got to work with a practitioner who understands whole body health. So if
Absolutely.
you go to so for me, I'll give you an example, Sharon. Like I might go to my GP and say, I need further diagnostic testing for my wrist because A, I have pain, and B, look at my thermography, look what's going on with my right hand, and it really coincides. And then my doctor, if they're a good doctor, they will partner with me and they'll say, okay, let's
Mm-hmm.
let's start doing some more imaging and see what's really going on with your hand. And but then there's this other factor where you really need to see the right practitioner for the
Yes.
right thing. So I am seeing
Mm-hmm.
a biological dentist
Good.
in June, and I am going to talk to her
Mm-hmm.
about simply maybe extracting this tooth for now,
Mm-hmm.
not putting the implant in right away. You can't anyway, I don't think. You've got to
Yeah.
take time.
And just letting it settle.
Let it settle down. And I think they can put like a placeholder when you extract a
Mm-hmm.
tooth. They do
Mm-hmm.
something because, first of all, getting a tooth is so expensive. Trust
I
me.
know.
7 grand for this side for
You
me.
are expensive,
Yeah. So my husband's like, I'm next in line. You got to wait your
right?
turn. You got to create a budget. And I always say
Yeah,
that. Get your health budget. So what I might do just in the interim is just pull the tooth.
absolutely.
And then here's another question for you, Sharon,
Mm-hmm.
which I know this because I have a heart murmur
Mm-hmm.
and mitral valve prolapse.
Mm-hmm.
And we all know that certain bacteria can affect your heart and
Yes.
cardiovascular.
So
So,
it may be that this root canal or this bacteria is, yeah, contributing to uh, that underlying inflammation and the cardiovascular related stress that we're seeing.
yes, yeah. And then we can't put this picture away without talking about the forehead. Like, what the hell's going on with my hot head forehead? What's
Yeah.
going
So
on?
again, that hot head, that hot forehead, that correlates to digestive health. And so people who have this flaming hot forehead, I say they've got an angry digestive system, right? The bacterial imbalance probably in the small intestine is going on. And so that's what the hot head means.
Hothead. There you go. I'm a hothead. Um, okay, so let's kind of get it. Those are some pretty cool imaging. I have to talk about this. I'm not going to put my breast photos up,
You refuse. Well, we could like, we could put them up and just like put a sensor thing over them or something. That'd be fun. I'm just kidding.
I don't know how to do that.
I know, right?
I
Like,
wish I did.
let's try and do that, like just on the spot.
Yeah, yeah, you might end up seeing my boobs in the interim because
Right? In
I
the
won't be
end.
able to figure it out. So what I will do is I'll explain that my breasts were mostly blue
Hmm.
with a little bit of green,
Yeah.
what I can tell. And I wasn't sure about my left breast if that was red or it was just not really. It was just pretty much blue.
Well, now I don't remember what those looked like. So I'd have to pull up the study here on my computer, but not show it
Yeah,
to
yeah.
remember to remind myself. Hold on.
Yeah,
Hold on.
because blue, typically blue is not bad. It's better than red, right?
Well, it depends. So that's kind of a loaded question, right?
Yeah.
Where um, blue can indicate, so blue indicates like colder areas. It can mean a change in circulation. So it can mean like congestion, or it can mean in terms of the musculoskeletal system that there's nerve impingement, lack of blood flows going somewhere. But sometimes when we actually talk about congestion in the study, sometimes people's thermography studies are really cold. Like everything, every part of their body is
Sharon,
really, really cold.
my
Yeah.
butt was really cold.
Yeah. So that's
Yeah, but
where
they
we
said that's like tight glutes.
tight glutes. Yeah.
Yeah.
So things are, we do expect to see some cool patterns in certain parts of the body. But again, when things are too cold or things are too hot, that tells us something that's going on. So if there's too much cold in the study, there's too much congestion, that really does mean a person has a chronic condition. They've been sick for a long time. They're very low energy. They're very congested. They're very toxic. So we look at these different ends of, or different like places on a health journey that people are on. So people always think about thermography as, well, it's where the hot spots are, that's where the problem is.
Yes.
Not always the case. If things are too cold, that can indicate like lack of circulation. It's the body's last attempt to bring blood supply from the skin in towards the tissue to try to heal it. So you have to understand, like when it comes to thermography, physiology, vasoconstriction, vasodilation, the nervous system and how all of that is connected. If you don't understand that, it makes it very hard to look at a thermography study and answer what is the body doing. So cool patterns in some areas, it's normal. But again, when skin temperature becomes too cold or too hot, that's where the problems actually, that's where the problems show up. So you have to know what you're looking at.
So
And I can't find your study.
explain my cold boobs.
Okay, well, so those cool breaths, I'm just looking for your study. Here it is. I will not show it.
Okay. Well, you know what? Like, I mean, in the end, it was just kind of funny because, people ask me about it because I've been talking about this
Yeah,
for a
yeah.
while.
So
And
yeah, your left. So I'll just say your left breast is a little bit colder than the right. So again, a little bit of a change in circulation there. That, of course, can come from musculoskeletal issues as well, right?
or lymph,
That's,
or
yeah,
lymph.
or lymph. That's why, and that's of course also related to musculoskeletal. So we have to look at the whole body to know if the breasts are cold. Why? Is it nerve? Is it lymph? Is it like the upper back is really out of alignment and that's causing circulatory issues? Typically, when we see some of these cooling patterns, it does indicate like congestion or density of the breast tissue.
Very dense. Yes,
Yeah.
I
So
have that.
again, like that's normal. But again, if women have very, very dense breast tissue and their breasts are very, very cold, that's a great environment for the lymph to become backed up, and that allows toxins to accumulate in the breast tissue. So again, cold is cooler breasts or whatever, pretty normal. But again, when things become too cold, we are concerned again about the lymphatic system and how that's flowing or not flowing. And yeah, what is it that we need to do to correct that? So yeah.
So here's a question. I have
Mm-hmm.
an old tumor in my breast. It's benign.
Mm-hmm.
It's a
Mm-hmm.
fibroadenoma. I think it's pretty common. A lot of women get that.
Very common. Mm-hmm.
I had it at the exact same. Here's what's really interesting. This is why I find looking at the whole body so interesting.
Mm-hmm.
So I had the tumor. I had to have the the core biopsy.
Oh.
They thought it was maybe cancerous. It was not
Mm-hmm.
fun. This was literally 1 month after I was diagnosed with thyroid cancer and 1 month before I had my thyroid removed. So I was like, what the hell? So I have
Mm-hmm.
thyroid cancer. Now I have breast cancer. Like, what's going on? There's a connection, my friends. There's always a connection.
Absolutely.
And I know one of the major factors, because I mean, that's my specialty is thyroid, is the lack of nutrients needed. Well, guess what? Not only your thyroid needs iodine, but so does your breast.
Mm-hmm.
So I just want to point that out because I had I don't know, is it still there? Like would a benign tumor show up hot, like red? No, it wouldn't.
No, not always. I mean, things again with thermography are not always so cut and dry, right?
Yeah.
Um, so yeah, like fibroadenomas typically, I mean, they don't often present with anything. Like nobody
Because
would
of
even
blood
know that
flow.
they're there.
No blood
Exactly.
flow, right?
Blood flow.
I mean,
Absolutely.
that's the big thing that I find so fascinating. And this is because I mean it's not a great thing, but unfortunately I know a lot about cancer. My daughter had cancer too.
Hmm.
And her oncologist explained that if it is malignant, it's got arms and legs and it's hanging on to other tissues in the body and gaining blood flow to the.
Hmm.
So I
Yeah.
guess my not having the red in my breast is probably a positive thing. I mean, but I still have to work on circulation. I still have to work on lymph. That's not to say that
Absolutely.
there's nothing to work on,
Hmm.
but
And
like,
I often talk to patients about like they think about like tumors and cysts and oh my God, like what are they, right?
yeah.
I often explain them as like their collection points for toxins, right? So the
Mhm.
body's always trying to like protect itself or heal itself or it knows it tries to keep this balance of homeostasis and it's amazing in what it will do to keep that. And so I often say to people, think about it like, if there's toxins in the body, they go somewhere, right? They go into your lymph system, they end up in your tissues. And so sometimes if you can get people to think about tumors or cysts or whatever as kind of collection points for toxins, it kind of gives them a little bit more insight as, if that's a collection point for toxins, that means I have toxins in my body. That means I need to address the source of the toxicity, right? And
Yes.
I think too, like about you, your previous root canal, like how much of that, right, traveled throughout your lymph system, possibly affecting your thyroid as well, because the thyroid is like a mop. It mops up toxins. It's like a sponge, right?
Crap, I never
And the
thought of
same with the
that.
breast tissue. Yeah. So think about, and then people start making the connections in their head. It's like, oh my gosh, I had this procedure done. And after that, I developed this, and this. And it helps them to make the connection of cause and effect, right?
Yes.
Goes
Yes.
on to, I mean, we can talk about all kinds of causes and effects, right? Even breast implants, women who have breast implants, we know that there is such a, non-formal condition known as breast implant illness. I think you've
Yep.
talked about this on one of your,
I have.
yeah, podcasts. And so women often don't think about the implants as being the cause. And sometimes, again, too, in a thermography study, you see all this inflammation. They have implants, and you start asking them, "Hey, when did all your symptoms start?" And the light bulb goes on.
Yes.
You know?
Yeah, I mean I agree. Oh my gosh, it's so fascinating how the body works because
Mm-hmm.
back when I had that root canal, that would have been about 2005, 2006, right after the birth of my second child and at the around the same time my teeth crumbled in my mouth It's like, what the hell's going on with my
Mm-hmm.
body? And we all know that pregnancy, if you're not nourishing your body well enough, the fetus is going to be taking from the mom.
Everything.
Yeah. And so it showed in my dental issues
Yes.
afterwards. So, it's so fascinating, but I'm going to have a great conversation with my biological dentist about that root canal. So I think it's important that I
Mm-hmm.
talk about what I decided to do. I mentioned that.
Yeah.
Listen, and by the way, you guys, this is the thing. What I'm doing is not necessarily what you're going to do if you see this. But Sharon, do you recommend practitioners that somebody can talk to, or do they talk to you
Mm-hmm.
afterwards?
Both. So we provide everybody with a follow-up phone call to talk about the report, the findings in the report, and we do provide everybody with like suggestions, recommendations, like, you need to see a dentist. Here's a recommendation for one in your area. We try to guide people. We try to connect people. We try to lead people, and then obviously, I mean, people then have to start taking responsibility, right? But absolutely, we want people to understand what it is that the thermography study is saying, how it applies to their current health situation, and then what steps do I need to do going forward to change my health direction. So yeah, we are totally engaged with our people who come for thermography studies.
I love it. So here's what I'm doing. Number one, I immediately went and took off these damn gel nails. I'm not judging anybody for doing it. I did it for 6 years and I'm a nutritionist. Whatever. I made the conscious decision when I saw my nail beds were so inflamed. I'm like, there's got to be a connection there. And then you add on top of it that I'm having some circulatory
Mm-hmm.
issues. So that might be obviously another factor. I am doing a drainage protocol using UNDA. I am personally trained in UNDA. Very gentle drainage. I always say to people, I don't recommend you go and buy a detox box off the shelf. Work
I
with a
agree.
practitioner. Work with a
Yes.
practitioner who understands drainage
Mm-hmm.
first.
For sure.
So I'm doing drainage with Unda. I'm also using Cellcore. Have you ever
Mm-hmm.
used Cellcore? So I'm
Yep.
using
Yep.
from them. It's a drainage protocol that actually addresses kidney, it addresses circulatory, and it
Mm-hmm.
addresses lymph.
Yep.
So I already do rebounding. I got a rebounder for Christmas. And the thing is that like, I'm trying because my mom had lymphatic cancer when she was 52. So for me, it's really, I know that that's a weakness for me. So I was trying to be proactive, but it's obviously not enough. Dry brushing is another thing that I'm doing. I'm trying to mitigate cell phone radiation by I'm using a FAZUP. Have you ever heard of FAZUP?
No, I haven't.
FAZUP. They're actually made in France and they are like little antennas
Oh.
phone. I when I did this scan, I had an Aries little sticker.
Oh, okay. Yeah, yeah. I think I know what that is.
Yeah, I don't think it did enough, Sharon.
Mhm.
I don't know.
It's that root canal that's
You
causing.
think that's it? You think that's the root of
I think
my
that's the root of your lymphatic issues.
and that you
I
you
do.
well, we're gonna see because I am
Yeah,
coming
it's going
back
to
to
be
you.
interesting.
I'm coming back to you. So then on top of it, because of the bacterial stuff that's going on that we saw with my forehead congestion, my hot head, I am starting a 3-month protocol with Akkermansia
Okay.
because here's the thing. Akkermansia has been shown to actually do something, whereas probiotics kind of come in,
Maintenance.
come
Probiotics
out.
are
It's
maintenance.
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 Yes.
You're not
Yes.
there.
No. So I'm also going to try a little bit of, have you ever heard of Dr. William Davis he
Yes.
wrote Wheat Belly? So I
Yeah.
interviewed him a while ago and he loves L. reuteri. strain. I don't know if you know a
Mm-hmm.
lot about it. So, but it's a strain that's been shown to actually proliferate. So, this is the problem with probiotics that you take every day. Like you said, it's maintenance, but it's not proliferating. It's not
Yeah.
building
It's
greener
not sticking
pasture.
around.
Yeah, it's not, yeah, exactly. And
Well, and
then,
people don't have the digestive environment for that good bacteria to stick around. They have so much bad
yes,
bacteria, right?
yes,
It's like it creates like a war. So yeah, probiotics are, everybody's like, I take probiotics. So it's like, okay, well, that's maintenance, and I don't think you're there yet. So we need to deal with like all of the toxins and bacterial overgrowth and all of that stuff before you even think about probiotics, right?
yeah. And most people, they know, who've been following me for a while, they know I started to have some pretty major gut issues at the exact same time as I had
Mm-hmm.
thyroid cancer. And I've been working really hard for 12 years now. I do believe that some part of this is genetic.
Mm-hmm.
Um, and because I have family members that have similar issues. So I'm working on it. And but Akkermansia and L. reuteri are a couple of things that I am adding in because they can actually change the environment in my gut, make for a better environment. That's what I'm looking for. I'm also going to start seeing my osteopath again.
Yay.
Yay. Because
Very
I need,
good.
yeah, because I was seeing him for a while and now I'm going to go back for regular sessions with him. And
Mm-hmm.
then the last thing, the root canal. So there's my protocol.
Absolutely.
There's my
Critical.
protocol. What do you think?
I think it's good. I think that, yeah, like address again, you've got to get to the source, right? So you can do all of these, supplements or drainage and whatever, and those all help to get things moving. But again, if you don't get rid of the source, you're just forever going to be like kind of garbage in, garbage out, right?
Yeah.
Recirculating. So yeah, it's so important to address cause.
Yeah. Yeah. I mean, and of course there could be a couple of causes, right? Like it's, you know,
Mhm.
in you've probably seen people who have a multitude.
They
Like,
do.
yeah.
They do. Yeah.
Yeah.
And you have to start sort of unraveling it one layer at a time, right? You
Yeah.
can't do everything at once. You can't address it all. You have to kind of do a systematic approach. And yeah, there's many moving parts, right?
Yeah. For me, 100%, I've obviously got the diet dialed in, the blood sugar dialed in. Stress, well, I do my best when it comes to stress, but listen, if anybody has kids,
You got stress.
you got stress and you can't quite get rid of that. And
No, no.
you can mitigate that stress a little bit. But this has been such a fun conversation. And I am coming back to you in 6 months because I do want to see, when I get that tooth pulled, when I do
Mm-hmm.
some of the drainage, when I see my osteopath for a while, when I kind of work on some of this, what will happen?
Right. What changes?
What changes and what doesn't?
Mm-hmm.
So that kind of
Absolutely.
gives you an idea of where else to go.
Mm-hmm. And I
Yeah.
like it because, we want people to um, understand the thermography study. I think you obviously have a little bit of, a step forward in that or a step up, you're a step ahead,
Yeah.
whatever it is, because of your background, right?
Yeah.
And so you take the information and you're like, this makes sense. This totally, I see the connections. And that's really what we try to do for people because we believe thermography is valuable. And we want them to understand what it is that this is showing them and, what it is that they need to be doing going forward to improve their health.
Yeah. Yeah. Sharon, this has been such a great chat. Please tell everybody, where can they find you?
So they can find us. They can go to our website, thermography.medicalclinic.com. We have a 1-800 number, 1-800-403-2041. We are located throughout Ontario. We have various clinics from the east to the west. And so, yeah, they can find us there, and any questions they have, they can either call or email, find
Okay.
us on social media.
That's great. And also, if somebody is out of town, like I have a lot of
Mhm.
listeners who are in the United States. Do you have companies that you refer or recognize in the US?
Yeah, so I'm actually part of an organization called the Institute for the Advancement of Medical Thermography, IAMT. I'm
Okay.
actually the director of education for there. So we do all kinds of educational webinars for thermographers, for practitioners. So that's IAMTonline.org. There they can find thermographers in the US. So not everyone probably writes reports the same way that I do. I think it's a little bit of a unique report presentation that I do specifically. But finding practitioners on IAMT, they'll be very similar in the way that they operate. So
Oh, that's great to know. That's really
mhm.
good to know. Thank you. Thank you so much for your time today, Sharon. I
You're
really
welcome.
appreciate you. Thank you.
Been fun. Hopefully, maybe we'll do it again.
Yeah, yeah. Follow up, follow up.
Absolutely, yes. All
Okay.
right.
Hold on one sec. I'm going to hit stop.